Hello, this is Dr. Do again. This video is on alphabetic list problems on letter L, still on lung diseases. And today I'm going to talk about another lung diseases which could be common in some people with predisposed risk factors. It's called interstitial lung diseases. What are the? I think if you recall, I mentioned about interstitial kidney diseases previously. Really referring to the diseases occur in the organ, any solid organ, not occur in the parenchymal cells, which mean the functional cells. So in between those functional cells are different kind of mesenchyme or other different kind of cells. So that's the interstitial lung disease referring to the conditions occurring in these cells and tissues. In between the parenchymal cells of the organ. So this is about lung. Let me just bring up the first priority. Any emergency situation associated with this interstitial lung diseases. Actually, this is the interstitial lung disease. Usually, it's a kind of long-term chronic process, but probably it's subtle and suddenly getting worse to the point that with limited lung volume cannot provide enough oxygen, cause hypoxia. But this is not common unless you do not know it and suddenly becomes really difficult breathing, reaching to the point, to the threshold, the lung lost the capacity to carry the oxygen to exchange, to provide oxygen, so cause the hypoxemia. If that's the case, you need to go to the emergency. Usually, it's a chronic process, gradually developed, unless there's some other cause, probably change the altitude from the plane to the high ground. You did not know it when you live like a normal life, and suddenly you take the airplane or you went to the mountain, really change the altitude. So if that's the case, that probably is the emergency. Usually the interstitial lung disease refers to, it's caused actually the progress of a chronic process. So any interstitial lung disease you can manage at home. Actually symptomatically management eventually for a lot of time for the interstitial lung disease. It's majority of the case, it depends on the causes. It's really difficult to manage. Steroid is one of the medication can be used, can improve the symptom, but there's no radical treatment for this interstitial lung disease. It's really the chronic progress, getting worse and worse, and symptomatic management to improve oxygen to maintain. That's the that's the prognosis for this interstitial lung disease. So having said that, you cannot manage at home. Has to be managed otherwise under your physician or medical team to tell you what kind of medication, what oxygen, for example, or steroid. So that's the basic, and other medications newly developed may improve the symptoms, so it has to be managed by the medical professionals. And talk about this interstitial lung disease. Let me just briefly review or talk about the lung structure. We talk about lung structures, the sac structure of the alveoli. Those alveoli lining with different cells called epithelial cells. And there are different types of the cells. There are two types actually. One, the type 2 cells I mentioned produce the surfactant to keep the alveoli opened, increase the compliance. And the other type of the epithelial cells of the sac is serving as the membrane for the gas exchange. So these two, the epithelial cells of the alveoli really refer to the parenchymal cells of the lung organ. And in between these sacs or the alveoli, there is different kind of cells. Those are the interstitial cells. Basically, the interstitial lung disease refer to those cells, non-parenchymal cells, and those cells are undergoing the fibrosis. So the lung undergoing fibrosis could also affect the alveoli indirectly because those fibrosis take over the space, and the main consequence of hypoxia or hypoxemia is because of this fibrosis thickened the structure that's responsible for the air to pass across this respiratory membrane. For example, the oxygen and the carbon dioxide freely pass the normal membranous structure along with the endothelial cells, epithelial cells, form the layers of the structure. So for gas exchange, but this interstitial disease really thickened, increased the distance of this gas exchange as the originally at the initial stage, and later on, just the whole lung will become fibrosis. So that's the worst of the long-term eventual consequence for this interstitial lung diseases. So what are the risk factors? Talk about the structure and then talk about risk factors. Usually it's because the air inspired, what kind of air is from the shipyard worker or a glass factory or the other dust area. Like that's the old, very classic causes or risk factors. Nowadays, the working environment improved, so less and less this interstitial lung disease compared to probably a couple of decades ago. The silicon, for example, is really the one of the risk group to have this interstitial lung disease. Other medications, the other causes probably is medications. Some of the medications really can increase the risk of lung diseases. So those are the risk factors. So if you work in those special environments, you probably already know it and you know how to prevent. Whether you have other, there's another risk factor is genetic. So if you have those kind of risk factors running in the family, you probably already know it. So this is about the risk factors. In terms of management, really, like I said, the fibrosis, interstitial lung disease really harden the lung, becoming like a scar on the skin. So the lung will be taken over by this scar-like fibrosis tissue, lost the capacity to function as a normal lung for the gas exchange. So the lung will be hardened and decrease the volume for air exchange, decrease the capacity. So that's the eventual. I think the radical treatment, probably the transplant. Nowadays, I think there's successful report for the lung transplantation. In addition to the cancer, use the transplantation from this interstitial lung disease probably is another group of candidates for the lung transplant. So this is about the interstitial lung disease. It's a very vague concept because it's, like I said, occurring in special group of people and with special risk factors. But the consequences, the prognosis is pretty bad. Actually, the consequences is quite serious. So I'm just thinking about this and brought here. If you have know somebody working in that environment or had family history of this, you probably just you can find more information about this interstitial lung diseases. So I'm going to stop here, and I hope it helps. And thank you for watching. I will see you next time.